It is a 4 marks question, direct question. Anastomosis around the elbow joint. It's a 4 marks, right? First point. First point. Radial collateral artery. Radial collateral artery. Anastomosis with the radial collateral artery. Anastomosis with the radial recurrent artery. Radial recurrent artery. So radial collateral artery, it is a branch of arteria profunda brachii. Then it runs downwards. Then anastomosis with the radial recurrent artery. So this radial recurrent artery arises from the radial artery. Okay. So radial artery nunchi vachina oka artery, it runs above. Whenever it runs above, we called as recurrent. Recurrent and eppudaina oka vessel gaani oka nerve gaani paiki run avutayi towards the above. So we called as recurrent. Okay. So these two both are anastomosis with each other. This is the first anastomotic point. Then come to the number 2, second anastomotic point. Second anastomotic point. Descending branch of posterior descending artery. Descending branch of posterior descending artery. Anastomosis with the interosseous recurrent artery. Interosseous recurrent artery. So it is a branch of posterior interosseous artery. It is a branch of posterior interosseous artery. It is a second anastomotic point. Then come to the third one. Transverse branch of posterior descending artery. Transverse branch of posterior descending artery. Anastomosis with the what is meant by anastomosis? Mixed with each other. Okay, two arteries separate okadanto okat meet avutundo dane anastomosis ante arterial anastomosis, right? So transverse branch of the inferior ulnar collateral artery. Transverse branch of posterior descending artery. Anastomosis with the transverse branch of inferior ulnar collateral artery. Inferior ulnar collateral artery tone anastomosis avutundi. So this one is a third anastomosis. Are you getting? Next, number 4. Anterior descending branch of inferior ulnar collateral artery. Inferior ulnar collateral artery. Anastomosis with the anterior ulnar recurrent artery. Anterior ulnar recurrent artery. So it is a branch of ulnar artery. It is a branch of ulnar artery. It is a fourth anastomotic point. Next, fifth anastomotic point. Fifth one. Superior ulnar collateral artery. Superior ulnar collateral artery. Anastomosis with the superior ulnar collateral artery. Anastomosis with the posterior descending branch of inferior ulnar collateral artery. Posterior descending branch of inferior ulnar collateral artery and anastomosis with the posterior ulnar recurrent artery. Posterior ulnar recurrent artery. So this one is a fifth anastomosis. In the fifth anastomosis, 3 branches in the fifth law. So number 1 is a superior ulnar collateral artery, and number 2 is a posterior descending branch of inferior ulnar collateral artery. Third one is a posterior ulnar recurrent artery. So this 5 anastomotic points around the elbow joint. Okay. So question enti arterial anastomosis around the elbow joint. 4 marks question. Are you getting? Next, come to the radial artery. So radial artery question em raadu. Radial artery and question em adugadu. Kaapothe radial artery and ulnar artery both are united to form a arches. Arterial arches. So that arches we called as superficial palmar arch, deep palmar arch, anterior carpal arch, posterior carpal arch. 4 arches ni form చేస్తారు. ఆ ఆర్చెస్ ని అడుగుతారు. అంతేగాని రేడియల్ ఆర్టరీ అని క్వశ్చన్ ఉండదు. అల్నార్ ఆర్టరీ అని క్వశ్చన్ ఉండదు. ఓకే, రైట్. సో ఫస్ట్ రేడియల్ ఆర్టరీ. రేడియల్ ఆర్టరీ, it is a branch of radial artery. It is a branch of brachial artery. Radial artery ఎక్కడి నుంచి వచ్చింది? It is a branch of brachial artery. It runs downwards towards the lateral side of the forearm. Towards the lateral side of the forearm, near the wrist joint. It gives a one transverse, anterior transverse branch. It gives a one anterior transverse branch. And number two, posterior transverse branch, anterior transverse branch and posterior transverse branch. It runs downwards. Bifurcate. It runs downwards, bifurcate means divides into 2. Bifurcate means divides into 2 branches. Bifurcate gives the 2 branches. Number 1, superficial palmar branch of the radial artery. Number 1, superficial palmar branch of the radial artery. That is the number 1. superficial palmar branch of the radial artery. And number 2, deep branch of the radial artery. Number 2, deep branch of the radial artery. So first we discuss about the anterior transverse branch. Anterior transverse branch, posterior transverse branch, then superficial palmar branch of the radial artery, and deep branch of the radial artery. So first term gurinchi maatladutunnam. Anterior transverse branch of the radial artery. Okay. Anterior transverse branch of the radial artery. Anastomosis with the anterior transverse branch of the ulnar artery. Anterior transverse branch of the ulnar artery. See here. So this one is a radial artery. So radial artery gives a one anterior transverse branch. Then it is anastomosis with the anterior transverse branch of the ulnar artery. Okay, anterior transverse branch of the ulnar artery and ఇంకా ఎంత anastomosis అవుతుంది and anastomosis with the anterior interosseous artery. And recurrent branch అంటే చూడండి రికరెంట్ అంటే ఏ బ్రాంచ్ పైకి వస్తుంది కదా ఈ బ్రాంచ్ ని రికరెంట్ అన్నాం. చూడండి ఇక్కడ anterior transverse branch of the radial artery, anterior transverse branch of the ulnar artery, anterior interosseous artery and recurrent artery. So these four unite to form a arch. These four arteries anastomosis with each other forms a arch. Right on, forms a arch called as anterior carpal arch. Forms a arch called as anterior carpal arch. Direct question వచ్చింది అనుకోండి 2 మార్క్స్ కి. anterior carpal arch ఏం రాయాలి? anterior transverse branch of the radial artery and anterior transverse branch of the ulnar artery, recurrent artery, anterior interosseous artery unite to form a anastomosis, forms a arch. So that arch we called as anterior carpal arch. Are you getting? 2 marks question, anterior carpal arch. Next, posterior transverse branch of the radial artery, posterior transverse branch of the radial artery and posterior transverse branch of the ulnar artery. Posterior transverse branch of the ulnar artery and posterior interosseous artery. Unite to form a arch called as posterior transverse branch of the radial artery, posterior transverse branch of the ulnar artery, posterior interosseous artery unite to form a arch called as posterior carpal arch. Posterior carpal arch. This posterior carpal arch gives a Posterior carpal arch gives a three gives a 3 dorsal metacarpal arteries. Posterior carpal arch gives a 3 dorsal metacarpal. Dorsal and ikkada back side. Dorsal metacarpal artery. Are you getting? So posterior carpal arch is a 2 marks question. So posterior carpal arch is formed by the posterior transverse branch of the radial artery, posterior transverse branch of the ulnar artery, posterior interosseous artery unite to form a arch called as posterior carpal arch. This posterior carpal arch gives the 3 branches. The 3 branches we called as dorsal metacarpal arteries. Okay. Next, in the hand, arteries in the hand, arteries in the hand లోపల arteries. ఇప్పటి వరకు రిస్ట్ వరకు వచ్చేసాం. ఇప్పుడు హ్యాండ్ లోపల చెప్పుకుంటాం. Arteries in the hand. Radial artery bifurcate. Radial artery bifurcate gives the 2 branches. Radial artery bifurcate gives the 2 branches near the upper border of the flexor retinaculum. ikkada near the upper border of the flexor retinaculum. Radial artery ఏమని రాసుకున్నాం? Radial artery bifurcate gives the 2 branches near the upper border of the flexor retinaculum. So 2 branches enti. Number 1 superficial branch. Branch and number 2 deep branch. Number 1 superficial branch and number 2 deep branch. First we discuss about the superficial branch. Superficial branch of the radial artery. Superficial branch of the radial artery runs beneath the flexor retinaculum. So sometimes it runs beneath the flexor retinaculum and sometimes it runs superficial to the flexor retinaculum. A point would write. Sometimes it passes through the superficial to the retinaculum. So ఎట్లైనా రాయొచ్చు. ఒకవేళ ఈ పాయింట్ అవసరం లేదనుకుంటే తీసేసినా మనకి ఏం ప్రాబ్లం లేదు. ఓకే. సో గివ్స్ a superficial branch అంతే. So this superficial branch runs deep to the flexor retinaculum, otherwise superficial to the flexor retinaculum. Okay. Next, superficial branch of the radial artery. Superficial branch of the radial artery and superficial branch of the ulnar artery. Superficial branch of the radial artery and superficial branch of the ulnar artery unite to form a arch called as superficial Palmar arch. Superficial Palmar arch. This superficial palmar arch gives the superficial palmar arch gives the three common distal nerves. Three common distal nerves. Sorry, three common distal arteries and nerves and three common distal arteries and one proper distal artery. Three common distal arteries, one proper distal artery. Okay. Next, each common distal artery bifurcate. Each common distal artery bifurcate gives a 6 proper distal arteries. Gives a 6 proper distal arteries. Are you getting? 6 proper distal. చూడండి ఒకసారి ఈ డయాగ్రామ్ ని అబ్జర్వ్ చేయండి. See here, this one is a superficial branch of the radial artery. Radial artery lo ఇది superficial branch కనిపిస్తుంది కదా. And this one is a superficial branch of the ulnar artery. Both are unite to form a arch. So this arch we called as superficial palmar arch. This superficial palmar arch gives a 1, 2, 3 common distal arteries and one proper distal artery. So each common distal artery bifurcated gives a 6 proper distal arteries. Appudu ee distal artery ki enno number undi? 1 first distal artery, second distal artery, third one third proper distal artery, fourth nunchi raskoru manam. Right on. Fourth proper distal artery, fourth proper distal artery supplies the fourth proper distal artery supplies the medial side of the index finger. Fourth proper distal artery supplies the medial side of the index finger. Next, fifth proper distal artery supplies the lateral side of the middle finger. Lateral side of the middle finger. Okay. Next, sixth proper distal artery supplies the medial side of the center finger or middle finger. Medial side of the center finger. Another number 6. Next, seventh one. Seventh proper distal artery supplies the lateral side of the ring finger. Lateral side of the ring finger. Another name? 6th item. 7th item. Next, 8th one. 8th proper distal artery supplies the medial side of the ring finger. That is 8th. Next, 9th proper distal artery. 9th one. 9th proper distal artery supplies the Ninth proper distal artery supplies the lateral side of the little finger. Lateral side of the little finger. Next, 10th proper distal artery supplies the medial side of the little finger. Medial side of the little finger. So this one is a superficial palmar arch. So superficial palmar arch is a 4 marks question. Okay. Anterior carpal arch is a 2 marks. Posterior carpal arch is a 2 marks. Superficial palmar arch is a 4 marks question. Okay. Then come to the deep palmar arch. You put deep. Write down the deep palmar arch. Deep palmar arch. Deep branch of the ulnar artery. Deep branch. Deep branch of the ulnar artery. And deep branch of the radial artery. Deep branch of the radial artery unite to form a arch called as deep palmar arch. Deep palmar arch. Next, inko point రండి. Deep branch of the radial artery. Deep branch of the radial artery. It winds the అంటే చుట్టూ తిరగడం. It winds the first metacarpal bone. It winds the first metacarpal bone. Enters into the palmar surface of the hand. Enters into the palmar surface of the hand. Here it gives a arteria principis pollicis. Arteria principis pollicis. See here, this one. Arteria principis pollicis. Arteria principis pollicis. Bifurcate gives a arteria principis pollicis. Bifurcate gives a 2 branches. 2 branches. అంటే దాన్ని ఏమన్నారు ఆ 2 branches ని మనం ఏమనుకోవాలి ఫస్ట్ అండ్ సెకండ్ ప్రాపర్ డిస్టల్ ఆర్టరీస్ అనుకోవాలి. నథింగ్ బట్ ఫస్ట్ అండ్ సెకండ్ ప్రాపర్ డిస్టల్ ఆర్టరీస్. ఫస్ట్ అండ్ సెకండ్ ప్రాపర్ డిస్టల్ ఆర్టరీస్ అని రాసుకోవాలి వాటిని. Principis pollicis artery bifurcate gives the 2 branches. ఆ 2 branches ని ఏమనుకోవాలి మనం ఫస్ట్ అండ్ సెకండ్ ప్రాపర్ డిస్టల్ ఆర్టరీస్. Right. First proper distal artery supplies the lateral side of the thumb finger. Lateral side of the thumb finger. Next, second proper distal artery. It supplies the medial side of the thumb finger. Medial side of the thumb finger. Next, this deep branch of the radial artery gives a deep branch of the radial artery gives a another branch called as arteria radialis indicis. Arteria radialis indicis. Arteria radialis indicis. Okay, this arteria radialis indicis supplies the, so దాన్ని మనం ఏమనుకోవాలి, థర్డ్ ప్రాపర్ డిస్టల్ అనుకోవాలి. సో ఇట్ ఈస్ నథింగ్ బట్ థర్డ్ ప్రాపర్ డిస్టల్ ఆర్టరీ అనుకుంటే మనకి ఈజీ చదువుకునేటప్పుడు, లేకపోతే కన్ఫ్యూజన్ లోకి వెళ్ళిపోతాం. ఓకే, థర్డ్ ప్రాపర్ డిస్టల్ ఆర్టరీ అనుకోండి. దాన్ని ఇన్ బ్రాకెట్స్ యూ రైట్ డౌన్ థర్డ్ ప్రాపర్ డిస్టల్ ఆర్టరీ. It supplies the lateral side of the index finger. Are you getting? One. Okay. So 1, 2, 3. So these 3 branches arises from the deep branch of the radial artery. Then 4th నుంచి 10th వరకు arise అయ్యేది దేని నుంచి, superficial palmar arch. Okay, next, deep palmar arch gives the next point. So deep palmar arch ఎంత ఫామ్ అయింది, formation of the deep palmar arch, deep terminal branch of the radial artery and deep branch of the ulnar artery unite to form a arch called as deep palmar. This deep palmar arch gives the 3 palmar metacarpal arteries. 3 palmar metacarpal arteries. This 3 palmar metacarpal arteries gives a 3 perforating arteries. 3 perforating arteries. 3 perforating arteries. Perforating arteries 3. And this deep palmar arch gives a one recurrent branch. Deep palmar arch gives a one recurrent branch. So deep palmar arch is a 4 marks question. Superficial palmar arch is a 4 marks question. Anterior carpal arch is a 2 marks question. Posterior carpal arch is a 2 marks question. చూడండి, ఇక్కడ పర్ఫోరేటింగ్ బ్రాంచెస్ అన్నమా, అక్కడ రాసుకోండి. దిస్ పర్ఫోరేటింగ్ బ్రాంచెస్ communicates the 3 dorsal metacarpal arteries. Communicates the 3 dorsal metacarpal arteries. So dorsal metacarpal arteries is a branch of dorsal metacarpal arteries. Posterior carpal arch branches. There, posterior carpal arch లో నుంచి branches. Are you getting? Yes. ఒకసారి డ్రా చేస్తాను, చూస్తారా? digits అన్నట్టు డిజిటల్ డిజిట్స్ అన్నట్టు ఓకే ఓకే axillary artery. First one is the axillary artery. So axillary artery is the axillary artery, first part, second part, and third part. So first part gives a one branch. What is the first part? First part ఏంటి? The first part చూడండి. First part, second part, and third part. First part gives a, see here, this one is a muscle. So this muscle we call as pectoralis major muscle. So this part is the first part. First part of the axillary artery gives a one branch called as superior thoracic artery, one branch only. Then second branch gives a thoracoacromial artery. This thoracoacromial artery gives a one clavicular branch. Clavicle ఉంది కదా ఇక్కడ. So one clavicular branch, one acromial branch, one pectoral branch, and one deltoid branch. The deltoid artery, acromial artery, clavicular artery, pectoral artery. Okay. Next, lateral thoracic artery. Second branch is the lateral thoracic artery. Next, third branch gives a One is anterior circumflex. See here, anterior circumflex and posterior circumflex. And another one is the subscapular artery. Subscapular artery. And this one is a brachial artery. So brachial artery gives the arteria profunda brachiate towards the radial side. So towards the radial side. Towards the radial side. So arteria profunda brachiate. Arteria profunda brachiate. So this arteria profunda brachiate gives the two branches. See here, number one is the radial collateral artery, and number two is the posterior descending branch. Posterior descending branch. Two arteries. Posterior descending branch. Next, brachial artery gives the superior ulnar collateral artery and inferior ulnar collateral artery. Inferior ulnar collateral artery. Have two branches. And see here is the brachial artery bifurcate. Gives the radial artery, ulnar artery. Radial artery body, ulnar artery. So this ulnar artery gives the common interosseous artery. Common interosseous artery bifurcate gives the anterior interosseous artery, posterior interosseous artery. Anterior and posterior interosseous arteries. You see here, this transverse branch gives the one descending branch, one transverse branch. Inferior ulnar collateral artery, it gives the three branches. One is transverse branch, another one is anterior descending branch, another one is posterior descending branch. Anterior, anterior descending branch, transverse branch. ఆ తర్వాత మీరు అసలు గీయలేదు చూస్తేనే మనం గీస్తాం ఓకేనా సో anterior descending branch, posterior descending branch, transverse branch. So transverse branch and transverse branch both are anastomosis with each other. And see here the anterior branch. So anterior branch and anterior ulnar recurrent branch. See here, anterior ulnar recurrent branch. Posterior is first anterior is anterior ulnar recurrent branch is both are unite to form an anastomosis. Okay. Next, posterior ulnar recurrent branch. అంటే దీన్ని చూస్తున్నాను posterior ulnar recurrent branch and superior ulnar collateral branch and posterior descending branch. These three unite to form an anastomosis. Three. Come to the radial side. Radial side, see here the descending branch, and this one is the interosseous branch. Interosseous branch, anastomosis with each other. Interosseous. And next one is the radial recurrent, and the radial collateral artery unite to form a anastomosis. So 1, 2, 3, 4, 5 anastomosis. So మిగతా స్టోరీ కనిపిస్తాయి ఎందుకంటే అక్కడ సరిపోదు మీకు కనిపించదు ఓకే అది వేరే ఇది వేరే అని అర్థం ఉండక కన్ఫ్యూజన్ అవుతారా? సేమ్ డయాగ్రామ్ ఇక్కడ ఉంది. ఓకే,